These are 5 things I think all nurses should be doing. Number 1 is bedside report. If you guys have followed me for a while, you know that I love bedside report, and bedside report seems to be a very controversial topic for a lot of you guys. Now, I understand that it may not be best to do a full-blown bedside report in every single patient's room. Sometimes there's information that needs to be talked about outside of the patient's room, but in general, I do think it is best to go in the patient's room, do an assessment with the off-going nurse, make sure everything is checked, labeled, alarms are on, bed alarm is on, so that way we have a consistent plan from one shift to the next. Even if you don't do a full report, even if you just go in, talk about the basics and assess the patient together, introduce who the new nurse is going to be, that's wonderful. Next is I think all nurses should take a lunch break. Listen, I understand there are days where we just cannot get a lunch break, and I get that. I've had those days too, so I know that realistically, we all should be taking lunch breaks, but sometimes it just doesn't happen. But in general, I think nurses should prioritize lunch and try to make time for lunch if they can. And I also think that hospitals need to do better at supporting nurses to help them get to lunch. The next thing I think all nurses should be doing is charting as they go, especially for things like your titrations, when you talk to doctors, orders, when you get a weird vital sign set. I think it's best to chart in real time as you go. Obviously, there's times where maybe you can't chart your assessment right then and there, but if there's something that sticks out that's abnormal, you call the doctor, you titrate a drip, chart that right as you do it, so that way you don't have to think, okay, what time did I call the doctor? When did I titrate this drip? The next thing is using your PTO. I think nurses should use their PTO. Nursing is a 24/7 job if you're in the hospital, and it's 24/7, meaning there's people there every single day, all the time, and you deserve to take a break. And the last thing is I think all nurses should be offered mental health resources, meaning like therapy, counseling. I think nurses should have adequate access to these things being covered by their employer. Nurses experience a high amount of stress and trauma, and over time, that affects your brain, that affects how you cope and process things, and I think that these resources should be at the forefront available for nurses. Okay, those are 5 things I think all nurses should do or have. Let me know if you can add anything to this list and if you agree or disagree with any of these things.